Starting today, many Americans will start paying more for their health care. It stems from Congress not extending subsidies that were part of a pandemic relief package. Jason Wheeler is here to explain what this means for people on ACA plans and potentially for the rest of us.
Izzy, this is a big deal for people who have ACA coverage, and there are a lot of them here. Texas, as you see here, we are the light green line. We are second only to Florida for the number of people who get their health insurance this way. And this is in large part because of those enhanced subsidies that started in 2021 and were always set to expire at the end of 2025 unless they were renewed. Now, the federal government gave those additional tax credits during the pandemic to get more people insured, and now many of them still need those subsidies to stay insured. Let's look at the numbers here. We're the blue line here. When this first started in 2021, Texas had about 1.3 million people getting their insurance through the ACA marketplace. By the time we got to 2025, that number had soared to almost 4 million people here in Texas. So how crucial are those subsidies for Texans who have ACA plans? If you follow the line across, 97% of them who are in the Affordable Care Act are getting those credits to help pay their premiums. That's close to the highest percentage in the entire country. Now, what happens next here? We've long reported on this. We're the green line here at the top. Texas has long had the most uninsured people in the country, if you look at it in terms of percentage or if you look at it in terms of the sheer numbers. We are number one in both categories there. And analysts at Texas A&M have put a finer point on this. They're looking at when those subsidies go away, they say that we could see as many as up to 800,000 more people no longer able to afford their coverage. KFF is estimating that that number could be closer to 1.3 million Texans who could become newly uninsured because of this. And here's why. They've put together this congressional map here and they've broken it up. You can see here, average premium increase, 161%. In this district here, 123%. In this one here, 183%. So some big increases there. But Congress is set to return from a long holiday break next week and will likely take this up again. Democrats have been pushing to extend the subsidies. Most Republicans haven't agreed to that. But the politics of this gets interesting because in many of these Republican-held congressional districts, a lot of people are getting those subsidies. 88,000 of them in that district, 73,000 in that district, 90,000 in that district. So again, this is going to be something to watch. And here's why you should care about this even if you don't have an ACA plan. The Texas Hospital Association predicts that without the subsidies, newly uninsured people will strain hospitals and increase insurance premiums for employers, and then we wonder how that trickles down to employees. There will be a lot to watch for with all of this in 2026, and we will be doing just that. Izzy?